Hi, we're going to talk about the surgical patient. So this is very basic information. So we're going to talk about concerns for the patient, different types and degrees of surgery, different types of anesthesia, phases of surgery, your responsibilities as a CNA, and then people who are in the actual operating room. Okay, so if you've ever had surgery yourself or had somebody that you love be in surgery, you already know that these are the concerns that this person's going to have. They're afraid of disfigurement, the pain that they're going to have afterwards. Just relinquishing control to somebody else is a hard thing for most people to, put your life into somebody else's hands. So there's going to be a lot of fear and anxiety involved in this. And then, of course, people are scared that they're not going to wake up afterwards. So that's a real big concern. So you as a CNA can be an emotional support to that person and be a listening ear. Please refrain from giving advice or telling your own stories or any of those things that are really not helpful. So there's different degrees of surgery. Emergent surgery is obviously an emergency. It's something that has to be done immediately. So maybe something like a trauma where we have to stop bleeding before the person bleeds to death. And urgent surgery needs to be done very, very soon, but it doesn't have to be done right at this moment. So that might be something like a mastectomy for breast cancer. We don't want to sit on that for a long time, but they don't necessarily have to go to the OR stat like you see in the movies. Elective surgery is something that I want to have done, something like maybe a cataract surgery, but it's not necessarily life-threatening. So there's different types of surgery too. So elective, like we said, that's something that I'm choosing to do. It could be breast augmentation or cataract surgery or LASIK surgery for my eyes. Explorative surgery is when we're really just going in and taking a look because we don't know what's going on. So, maybe somebody's having severe abdominal pain and none of the scans are really showing anything, so we might have to go in and explore. Urgent we've talked about, emergent we've talked about, and then transplant surgery is obviously to transplant organs from a donor, whether it's a live donor or a post-mortem donor like bones or skin to another person. So there's different types of anesthesia too. So general anesthesia is when you're completely out. So all of your life functions depend on the anesthesiologist. Breathing, urination. You don't have control of any of that. All of your organs are kind of on hold. You're put into a coma. Regional is for a section of the body. So an example of that could be an epidural. And then local is for a very small portion of the body, so maybe a tooth or a finger. We're just numbing that one area so that we can work on it. Different phases of surgery. The perioperative phase is the entire process from pre-op to post-op, so the entire time that you're there. So preoperative is where the person is that's where consent is obtained, so this, the procedure is explained, and make sure everybody's on the same page, all the questions are answered before the person gets any type of anesthesia. This is also where somebody might put an IV in or clean the area to prep it for surgery. Intraoperative is in the actual operating room. So this is when the person's put under anesthesia and the procedure is performed. And then post-operative, sometimes that's called PACU, post-anesthesia care unit. You might hear it called that. That is where the person is recovering after surgery. So we're making sure that they wake up okay, that they're well enough to go home, that they receive any post-operative instructions, that somebody's there to pick them up, make sure that their vital signs are normal after surgery, that they're breathing okay, that they're able to void. And then they're either, discharged home if it's an outpatient procedure, or if it's an inpatient procedure, they'll go back to their room afterwards. The responsibilities of a CNA, some operating areas don't even utilize CNAs at all, but if they do, that person's going to be there to make sure the linens are changed on the beds. They get the equipment. Of course, we get vital signs. They can get vital signs before, during, and after the operation. They can help with transfers, whether it's from stretcher to stretcher or from wheelchair. Repositioning is a big one. We've talked about before, if you have to be repositioned every 2 hours, that includes in the operating room too. If we have an operation that lasts for 6 hours, then we have to reposition that person or they're going to end up getting a pressure ulcer. We also assist with elimination needs and collect eyes and nose. Eyes and nose become really important during an operation, especially if there's blood loss or, if somebody has a catheter, then we need to be measuring that. Anything that comes in and everything that comes out. So these are some of the people that you're going to see in the operating room. They try to limit the amount of people that go into the operating room to as few as possible because we try to keep this environment sterile. We're opening somebody up, we're breaking that first layer of defense in their skin, so the risk for infection is huge. So here's some of the people that you'll see. So the person that's really in charge in the operating room is the anesthesiologist. Some people might think the surgeon's the one that would be mainly in charge, but the anesthesiologist or the nurse anesthetist is the one that is in charge of all this person's vital functions. So when they say go, you go. When they say stop, you stop. They're in charge. The surgeon is the one performing the procedures, so whatever it is that needs to be done, they're only focused on that one area. The assistant is the person that might be helping the surgeon, so they might be holding clamps, they might, they basically do whatever the surgeon asks them to do. And this is somebody that's been trained to do that. The circulating nurse is the one that's kind of monitoring the whole room, making sure everybody's staying sterile, making sure that they're recording vital signs, they're watching the instruments that are being handed over, and a lot of times they do the counts beforehand and the counts after surgery. So they count every single gauze, every single piece of equipment, because we've all heard the horror stories of stuff being left inside of people. So that's an important job. And then the the scrub is the person that's handing instruments over. And that could be a tech, could also be a nurse. So there's scrub nurses and there are scrub techs. It really depends on the facility, what they choose to use, but also regulations in different states too, and what people are allowed to do. So hopefully you'll have an opportunity to watch an operation being done so that you can get a better idea of what you're going to be seeing. Other than that, that's the end of this lesson.